Throughout healthcare and throughout health, we see a number of inequities. We know that there are differences in access to transplantation or access to both primary care and primary interventions, and then tertiary care, so some of these specialty interventions. The Dalio Center for Health Justice started as an idea in the summer of 2020. In the wake of George Floyd's murder, in the shadow of what we were seeing in terms of COVID-19 and the first waves of the pandemic, and the crystallization of the disparities that we saw, we knew at New York Presbyterian that we had to do something. So the Dalio Center was born.
The Dalio Center for Health Justice is a center that focuses on health equity and health justice for patients across the New York Presbyterian health system. Our base is data and infrastructure, using that data to drive change and as evidence to what's going to be the best way to take care of patients.
Since the Dalio Center's inception, we've always focused on a data-informed process and said that part of our success will be in our ability to allow the data to help inform, where we prioritize our work and our efforts, but also on the back end in our ability to measure our success and closing health equity gaps. Last year, we launched our We Ask Because We Care program. The first year of that program, we focused very much on better collection of race, ethnicity, language, sexual orientation, and gender identity information. The real goal is to ensure that our staff who are actually collecting this information understand why it's important to ask about race and ethnicity, and that they feel comfortable articulating that importance back to the patients.
Every single time that you want to tackle inequities, what you have to start doing is looking at the data. So as a pediatrician, health inequities that we see and ones that we're trying to tackle at this time are ones that we see in early intervention. The first 3 years of a child's life are critical for brain development. So as pediatricians, anything that we can do on those 3 years to optimize brain development, to buffer toxic stress, are key for the long-term life of that child and an adult. Our systems of care have been transformed to try to identify inequities that our children face from 0 to 3 to make sure that every single child by age 5 is ready to learn.
After a patient's been in the hospital for a couple of days, they don't feel the greatest. You can't get up and take a regular shower, get in a bathtub. You can't wash your hair with the shampoo and conditioner you would use at home. The Crown Hair Care project started after a patient care director named Felicia Aline approached the Dalio Center after having a patient who they noticed was using different hair care products brought into the hospital, and that patient was African American. New York Presbyterian recognized that it was important for us to care for patients with different hair textures by offering them products that included moisturizing. That's a simple inequity that no one does on purpose, right? But it's also not thought about. And that's where I think the impact comes in of how do we really focus on these small changes that make a huge change for our patients.
The sickle cell focus for the Dalio Center came about because this is really one disease in which the disparity is glaring. There is a huge problem that occurs when patients transition from the pediatric setting to the adult setting. This results in a lot of individuals being lost to follow-up. And this is not because the providers are not able to provide this care, but because these patients are not able to navigate a new system. Areas of focus for this program involve getting a navigator to provide assistance to patients for all of their needs, especially around transition. So this individual will help set up appointments, set up visits for these patients to all of these different providers in the system. The patient-centered approach is really important because we have to have a dialogue with patients. Patients have a point of view. We need to pay attention to what they feel is important in their care, not only what we feel is important in their care.
Over the summer, the Dalio Center for Health Justice decided we wanted to do some of our work in Central Brooklyn. Our relationship with Central Brooklyn is not as long as a hospital system as in some of our other areas in Upper Manhattan or even in Midtown. We met with community members and leaders, and we listened. And we said, how can we work together? So we started that with a video. We highlighted the experience of women during COVID who had given birth from Central Brooklyn. We created a documentary that really talked about the feelings of isolation as well as the feelings of community. And we premiered that documentary video at a beautiful celebratory event at the Brooklyn Children's Museum. It was the beginning of a conversation. It was the beginning of community conversations.
Coming out of nursing school, everything is about what's immediately happening with the patient. And now I have an opportunity to not only see the immediate things happening with patients, but across their lifespan, how we really can make an impact and care for them.
We started the Dalio Center for Health Justice knowing that this could not just be a moment in time. And I think that makes sure that this work is sustainable. And it's that is truly my hope. It's that in the future, we are all doing this work together. We're collaborating, because that's the only real way that we're going to make a difference across the country and for all the communities that we serve.